Hi, I'm Dr. Donovan from the DispensaryOnline.com. I'm here to talk to you about a very interesting product. This is a mouthful. Choline stabilized orthosilicic acid. Choline stabilized orthosilicic acid? What the heck is that? It is a form of water-soluble silica. Now, silica is a natural mineral that is all throughout our planet. And this water-soluble silica is very prevalent in natural water sources, particularly spring water and streams and rivers and freshwater lakes. The sources of our water supply before we began treating our water supply. So evolutionarily, we grew up drinking from streams, drinking from springs, freshwater springs, and so we were exposed to this orthosilicic acid, or this water-soluble silica, on a very regular basis. So it was evolutionarily friendly to our biological systems. So what does that mean? And what's the value of this water-soluble silica? Water-soluble silica is a mineral that promotes the regeneration and growth of collagen. Now, collagen is very important because all of the connective tissue of our bodies are made of collagen, including the webbing within the bone. And that webbing is where the calcium gets laid down in our bones. Our nails are made of collagen, our hair is made of collagen, our muscles, connective tissues, as I said, our tendons are all made of collagen. Now, if we can take in a substance that helps us regenerate and grow new collagen, then it should make our nails stronger, it should make our hair better, it should improve the quality of our tendons and the strength of our connective tissue in our body. And if it is a part of the webbing that the calcium is laid down on in our bones, then it should also improve the strength of our bones. Well, guess what? There have been some very good peer-reviewed clinical studies done to show just that. There were some studies done on the water-soluble silica for improving bone strength and bone calcification in osteopenic and osteoporotic women. And in the study, they looked at giving one group vitamin D and calcium and a placebo. The other group, calcium, vitamin D, and the orthosilicic acid, or the water-soluble silica, all in the same amounts. And over a 12 to 18 month period, the group that was given the orthosilicic acid, or the water-soluble silica with the vitamin D and calcium, had 37% more density to their bones at the end of the study. So it does help in the treatment of osteoporosis and osteopenia, as well as in the prevention of osteopenia and osteoporosis. However, side effects were noted by this, by the people gathering the information in the studies. And the side effects basically were people's nails were getting stronger. Their hair was getting more lustrous and thicker. And their skin was starting to look younger and better. And so they decided they would do studies on this orthosilicic acid, again the water-soluble silica, in women with sun-damaged skin and hair, and in women with smoking, cigarette smoking, damaged skin and hair. And in those studies, sure enough, in approximately 1 year or so, the improvement was clearly visible in the quality and strength of their nails, in the quality and luster of their hair, as well as their skin. So, do we get water-soluble silica on a regular basis anymore from our water supply? Basically not. It's taken out with the treatment that is commonly done in most cities on our water supply. So, I recommend having a product on board that contains the water-soluble silica In our pharmacy we use Regeno-Vis, and I use it as a part of my treatment for all my osteoporotic and osteopenic patients. It has really been remarkable at the improvement in their bone density that we've seen over an 18-month period. We usually choose about 18 months before we redo the DEXA scans in our patients when we're actively treating them for osteoporosis or osteopenia. I think it's a great product. Take a look at any of the information that we can offer on it, and certainly if you're up to looking at the studies, take a look at the studies. They're pretty impressive. Thanks.